Hi, this is Eric Pure Fitness. We're here at this week's fitness tip, and we're going to talk about hip mobility. Hip mobility is really important. When we talk about mobility, it's different than flexibility. Flexibility is how far your muscles basically can lengthen. We're talking about how well your joints move. And a lot of times we get joints that get kind of impinged or kind of crushed down where they start to stick and catch, and the hips are one of those joints. Now, what is hip mobility? How does that transfer over into exercise? Well, if your hips are mobile, you're able to squat better without pain, deeper. I can tell you that's a big part for me. I still like to do squats, and doing hip mobility is just, it's night and day. If I don't do it, my back hurts, my hips hurt. So important for squats. Also important too is I had a client in here this week that had knee problems, and the issue all seemed to be stemming because her hip wasn't moving right. Remember, everything's connected, so a lot of times when you have knee problems, you look below to the ankle or above to the hip. And same thing, as you look for lower back problems, a lot of times can be traced back to the hip. So doing some good hip mobility makes you move better, makes you perform better in the exercise realm. So we're going to use this Rouge band. You can get these at roguefitness.com, you'll see on the post. These are good heavy bands. We're going to create what's called distraction in the joint. That means we're going to put some pressure on the joint, and we're just going to fasten it to squat rack like so. And then we're going to do a step into this thing here. And we always want to set up where it's kind of pulling back into the side, so kind of a diagonal pull. And for the first one I'm going to do is called hip flexion. I'm going to create some pressure here on my hip. I'm going to pull this almost like it's pulling my hip a little bit out of the socket. It's creating some good space. And I'm going to do hip flexion. So I want to maybe have this for balance. I got to lean back against this. And then I'm going to push into hip flexion, keeping that tension on. Just gently come back out. Push in, hold that there for a few seconds. Come back out. Okay, this is the hip flexion. Just one here. I would recommend 3 sets of 10 of this. The next one we can do is also internal rotation of the hip. Step out here. Once again, I'm setting up where it's coming back on the side that kind of pulls my hip back, opens up the joint. And what I'm going to do is I'm going to just take and I'm going to turn in right here. But I want to turn at the hip. I don't want to launch with my lower back. I want to turn in and back out. Turn in, back out. Working on my hip. Keep my foot flat. This is internal rotation. The third one we're going to do is external rotation. The hip rotates internally and externally, so we want to do all of them. So we're going to reposition here, pulling back, make sure you have the tension that's appropriate for you. And then we're just going to turn out. And be ready for these heavy bands. A lot of times they might pull you a little bit, so you kind of want to be ready for that. And make sure you're rotating from the hip. You're not using your back to do the rotation. 3 sets of 10 on each of these. So these bands are great. You can do them on different joints. The hip's the one we're talking about this week. The next week we'll show you some shoulder stuff you can do if you have shoulders that are kind of catchy from bench pressing or whatever you do, overhead pressing. But 3 sets of 10. Just set up on a squat rack about hip level. Fasten in there tight, create some distraction. Do 3 sets of 10 before your workout. If you're doing a lower body workout, see if you notice a difference, or before a run. You should notice a difference. You should also notice a difference how you walk and run. Your hips feel a lot lighter, a lot less pressure in the low back, maybe in the hip area, and give it a try. So that's our fitness tip of the week: hip mobilization with distraction using the heavy bands. We'll see you next week.